during the pandemic, it was very difficult to run the internship program because, there were issues with people coming in and also people being really busy during the pandemic. So what we did for the internship program for part of it, and what we did was actually develop a pilot. We currently have an internship program that has people who can come in and do public health internships, and also people who can come to do public health clinical internships. We put money into developing an internship program that would have an internship director who's like in charge of the overall strategy and working with, how to really integrate internships into our New Mexico Department of Health, and then have 2 field coordinators. One field coordinator that just deals with clinical placements, right? And then one field coordinator that deals with public health program placements. And then one other person who would be the kind of faculty person or person who checks in with the students to say, let's meet once a week, let's see what you're learning. They help them navigate the system, they onboard them, they offboard them, and they help them kind of understand their experience within the framework of public health. So that is kind of what we're trying to build right now at the New Mexico Department of Health. Like I said, we were in the midst of COVID, and now we're just now coming out of that. So we're starting to hire for those positions and put things together. What we did during the pandemic, just because everyone was so busy, is we met with our team, our vaccine equity team, and said, what are the things that are really concrete that students can do with us, right? And that will really contribute to improving our program. So really bringing them into a program, but giving them really clear, concrete guideposts of what they can do. So for instance, in our case, for the vaccine equity grant that we had, we really needed to translate, right, the feedback that community health workers and community members were giving us about vaccine, like, hey, we're not able to get to vaccine sites, or we don't understand the messaging doesn't make sense to us, right? So really then what we did is got our students to do co-develop surveys with our community health workers, with our team, and then go out with the community health workers to use the survey in the communities, and then develop educational materials with the community. But like what they had to learn was that they thought that they were done with one like educational slide, right? And they didn't realize they'd have to go back to the community like 5 or 6 times and then build that slide with them, that educational slide with them. And so I think it teaches, it teaches the students like, hey, if we want to do community-based public health work, we actually really have to be in the community. We have to listen to people and then use our skills, right? We each have a different skill set to, like, they were really good at graphic design, right? And then they were really good at, making these materials. Like, we don't have time to do that. They were good at analyzing the data and giving it back to the community. So giving them these concrete tasks where they can learn, but they can also learn the skills of like cultural humility, like how to listen to communities, right? How to really interface and be humble and not be like, hey, I know everything, but like, hey, everyone has something to learn from all of this, and then guiding them through that process. So that's kind of what we're doing with internships. I think it's really trying to meet the needs of communities and our programs, and at the same time meet the community's needs of the students, right? To really build that pipeline. So it's really that balance is what we're trying to do here at the Department of Health. I mean, I think there are a lot of bumps and challenges in general with interfacing educational experiences with like ongoing things, especially during a pandemic. Like, how do you take the time to work with your students? How do you make sure your students actually feel integrated into the system? There were challenges of being online, and some of our interns had to do it online. Some of our interns could do it in person. So I think some of these challenges that the pandemic brought up were unexpected for us, I would say the issues of anti-racism, right? And just being like uh, trying to help the students understand that, there are root causes of what's happening right now, right? And that it's not just whatever's in your face right now, but that there's historical reasons why something is the way it is. I think trying to help people understand, the complexities of public health. And I think, and that's the beauty of public health too, is that the complexities and how we meet those challenges is part of what makes public health cool. So those are just some of these unexpected things that like, oh, we need to add that to the curriculum. I think that some of the things that are helpful to know is, can we get, I would have loved to see if we could get some funding for some of our interns and our preceptors, being able to think through how we compensate people to work with interns and also compensate communities, right? I think people think, oh, we'll just put an intern in a community, organization that we're working with. But I think that, most of the community organizations we were working with, they also need time and money to run their programs. So I think really trying to think about how we can work with our communities, orgs that we're doing as part of our, health equity work, but say, and you know what, as part of this health equity work and building the pipeline, we want to have some of your community members who are students, right, be part of this, but be able to pay them to pay you as well to try to like build that pipeline so that people who are, more vulnerable, they don't have the resources, can participate in internships, and community orgs can also participate. Like the advice I have is really like kind of working with the actual, like whatever the health universities that you're working with is trying to see if they can co-direct the program with us, right? So like what we're doing right now with the University of New Mexico for the internship program is they have a class associated with their interns, right? And so we're just making sure that with that class they already have, they can then know like what projects we have, and I don't know, just kind of educating them that like we can't have a bunch of, I mean, it's sad, but we can't have a ton of students who have their own ideas for projects to come in and do them. That's really hard for us to do, right? Because we already have like established projects that we're doing. So I think it's actually more work on the workforce if they like, you have to customize every intern to the project. So what we've been trying to work with our partners on is that, look, here's, and that also puts it on us too, but like, here's a set of projects that they can work on. Here's the deliverables we want them to, accomplish while they're here. It's on us to make sure those deliverables are doable within their time frame, and then work with their, with our partners to say, okay, here, if they can prepare them to know that they're not gonna like, have this like new save the world project at the DOH, like that it's gonna be part of something, they're gonna be part of something bigger together with us. But like, yeah, but having preset projects I think is really, really helpful. And then the piece about like having an intern coordinator who's like checking in with them, like not necessarily you, because you're, maybe they have something to tell you that they don't feel comfortable telling you. They can tell like a more peer-like internship coordinator, and then you can keep on improving the program that way. So I think having the appropriate staff to support you in your internship program is really helpful, and having that as a space for students to be able to like reflect on what they're doing and actually then be really excited about public health. I think the staffing really, I think we can't try to think we can do all of it ourselves. I think having the appropriate staffing to support the interns, to support your program staff is like just to me has just changed the way I do things, right? Like, you know, I think when I first started doing internships, I tried to do it all myself, and you know, it just made you like, just like going like, oh my God, my intern's coming today, you know, and then you're like, what do I have for them, right? But like, if you have like staff to support you and say, hey, you know, this, you know, I like my staff person literally met with the interns and said, what are your deliverables for this week, you know? And they just keep them on track, right? And I'd work with the intern coordinator to make sure the projects were things that, you know, students could do. So I think just having that support allows you to do your work, but then also helps you to have the time to really mentor someone to love public health, to like actually understand what we're all about, and also to work on things like equity, right? That requires time and listening to the communities, and really, you know, being you know, a person who can bridge, you know, what communities are asking for and listening to them, and then what public health can offer, and really build together. But that requires like time and mentorship and support. So. For our Department of Health, like I said, we ran a small pilot last year with 10 student interns who really contributed hugely to our vaccine equity efforts in the community. What I'd like to do, and we ran it off a skeleton crew, what I'd really like to see now is that we can get all the staffing positions that we need for this internship program and really build it up. And we do have a lot of amazing champions in our Department of Health who want to do this, as well as champions at the university. And I think that's what's going to make us be able to build this for the future. But, you know, we're not there yet, but we're working towards that. So.